Hi, this is Dr. Jerrold Bonn, and I want to talk today about panic disorder. Panic disorder is a terrifying condition that afflicts more than 10 million Americans at any time. It's terrifying to the sufferer and yet so difficult to understand, and even more difficult to explain to loved ones and to helpers, to doctors who are trying to be of help with the condition. Very often the terror is suffered in privately by the person. It's a prison for a lot of people. What panic is a very physical condition. It's tightness is very physical, and shortness of breath, and panicking over the shortness of breath. There can be palpitations because the body is in a state of panic, as well as tingling in the fingers that comes from the tightness itself, and lightheadedness, which occurs when panic has been sustained for a few minutes because of the drop in blood sugar. Panic is very rapidly escalating when it occurs. With each panic attack, the person is more vulnerable to subsequent attacks, and there is a lingering, after each attack, there's a lingering fear of fear itself, fear of confinement, and ultimately a imprisonment called agoraphobia, where the only safe place where one is free of the panic triggers is in one's own home, the rest of the world having become an unsafe place. The people who are vulnerable to panic disorder, first of all, are people who are genetically loaded, people whose families have a number of panic sufferers who share the same genes, and those who have experienced physical trauma, the sudden exposure to threat to existence, to either through traffic situation or a physical threat, physical assault. And another group that's very vulnerable to panic are people who go through life with the strategy of pleasing other people, of getting through by just subordinating what they want to the wishes of more powerful or more important people around them. And the problem over time is that a resentment can arise, because the more that you please people, the more that you subordinate what you really want and don't express what you really want, the more you come to resent the very situations that you have created for yourself. Now, the initial event of panic disorder always includes a misinterpretation by the person of the physical the physical events, the physical pain and distress that they're experiencing, and they misinterpret it as though there is an external attack of some kind of threatening situation, physical situation. They believe that they're dying, or that they're losing their sanity, their grip, or that they have to rush to an accident ward. Once the physical misinterpretation has been made, a person is on a slippery slope of increasing panic attacks. Now, the treatment has a lot to do with helping to attain the conviction that there is not a physical emergency, that this is in fact a mind-body mutual aggravation, which is understandable and controllable. Now, the treatment has a lot to do with learning mind-body skills to gain self-calming, to replace the mutual aggravation that the natural panic attack is, with the ability to calm both the mind and the body simultaneously. And this has a lot to do with the understanding of it, and also learning breathing techniques which calm and take away the escalating tightness of the body, replacing it with an effect of the body that the person can control. Therapy has also to do with mastery of sleep problems, and there must be the attainment of calmness on arising, which may involve medication help as well. Therapy certainly has to do with helping to reduce fear of relational conflict through behavior rehearsal, teaching people how to bring about to the important people in their life the communication of what it is that they want and what it is that they don't want. Journaling is very important in people learning how to rehearse, how to communicate and get across what they want and need, instead of having to give away the store. There's also learning how to convey criticism to another person, disagreement diplomatically, and voice management is extremely important too and can be taught. There has to be in treatment a step-by-step exposure to the feared situation, to the avoided situation, and sort of developing the ability to take small amounts of a situation that's been avoided, and each step leading to another step of longer exposure. There has to be planning. People have to be taught how to understand the situations of unexpected confinement that is very often the trigger for new panic attacks in people who have lost confidence in their mind-body interaction. They have to understand that there's going to be unexpected delays, unexpected confinements in travel, in shopping, in going to social events or religious events. Things can take longer than you expect. A classical trigger for panic disorder is a shopping checkout line in a supermarket, where somebody in front of the person pulls out a credit card or food stamps, and what seems to be an easy exit is all of a sudden become much more delayed than they expected. The understanding that the gaining of the exit door is very important, and learning how to calm oneself when that exit door is blocked is extremely important. And finally, in the treatment of panic disorder, the treater has to have access, has to be able to prescribe those medications which help to block out the panic effect. And this is something that there needs to be an anti-anxiety medication that can be prescribed in the moment, as well as long-term panic-blocking medications, which are helpful, but require all these other skills and educational interventions that I've talked about today. The most important idea about panic is that it is eminently treatable, and that people who have panic can achieve mastery and relief from panic, and it does not have to cloud their life, and they don't have to live in chronic imprisonment. People can learn mind-body mastery and can learn to live a life without panic. Thank you very much. I hope this has been of help. This is Dr. Bonn, and talk to you again. Thanks. Bye-bye.